Hello.
Hello.
I'm Ashira Maina.
Pleasure to meet
Pleasure
you.
to meet you. Sorry for making you wait.
No.
Okay, karibuni. I rarely go out, even to the shops, maybe like once or twice a week. My immunity being low, um, there's that fear, and COVID-19 being a respiratory condition, and I already have an issue with my lungs. So yeah, there's that fear of contracting it because I know, God forbid, if I happen to get it, that would mean taking me down pretty fast.
I was really shocked when I came to learn that she could no longer go to school because of a condition which started as just a pain in one of her ankles and later developing into pain in both of her ankles and swelling.
I had juvenile rheumatoid arthritis. That is an autoimmune condition whereby the body attacks the health tissues, cells, and so the body starts attacking itself.
When the body defends itself, it recruits white blood cells, which then play an important role in defending the body against infection, whether it is viral infection, bacterial infection.
Sometimes I regard Eunice as the pioneer of this condition because as a family we have not come across anybody else who was diagnosed with this condition much earlier than Eunice. And over the years, we have come to understand this condition. I do remember we going from hospital to hospital, many times being admitted and getting different medications and different diagnoses.
The disorders present with a very wide variety of symptoms and signs. And for example, they may present with fatigue, they present with joint pains or muscle pains. And some of these may be referred to different systems, not just autoimmune disorders. And so when patients present in this sort of way, many doctors will be prone to making a comfortable diagnosis, which may not be an autoimmune disorder. And as a result, it may take a very long time before one arrives at the real diagnosis.
At one point, I remember I got admitted at Gertrude's Hospital, and I was put on a lot of aspirin, and which ended up irritating my stomach because I used to take about 16 aspirins per day.
Many patients are very relieved when you arrive at a diagnosis because they've been they've been dealing with the problem for a very long time, and it's almost as if they can see some light at the end of a tunnel.
Even though at that particular time we are relieved, she had already left school because she had flares from time to time.
I remember I was put on some drugs I couldn't understand because at that time I was 9 years. And it is after several hospital admissions at KNH. I remember this one morning, a pediatrician came and he looked at me and he said, "This girl shows the symptoms of lupus because with lupus you get a butterfly, which is also called a malarash across the nose." So he said this was lupus, and they started me on medication. So I started going for clinics. At that time there was no rheumatologist known, so I was being treated by a pediatrician.
In individuals with lupus, there are defects in this system where white cells begin to attack bacteria and viruses and other invaders of the human body. What then happens is the white cells begin to attack the body itself. When that happens, then we say that the patient has defects in his autoimmunity.
In 1991, because my dad had traveled to the UK for studies, so I had the opportunity to travel there for further treatment.
She underwent treatment for 1.5 years. She also attended the school there.
We have various tests that may be done, some of them very expensive, that help you to narrow down on the kind of disorder you are dealing with. These tests vary. It may be a simple test like just a blood sugar that will tell you this patient has diabetes, for example. It's important to tie this in with family history, which will suggest that the patient may be having this kind of disorder. Or it may be a more complicated and expensive immunological test.
After some tests, they found I also had a rheumatoid arthritis. It's when you have one autoimmune condition, you tend to have an overlap of other conditions.
There are a wide variety of disorders that have defects in autoimmunity. Autoimmune disorders will include diabetes. Autoimmune disorders will include thyroid disorders as well. Autoimmune disorders will also include neurological problems.
I was diagnosed in 2013, and for me, I just fell at work, and they called an ambulance, and I was in the hospital for like 2 weeks. I was diagnosed on day 4 of the hospital of the hospitalization, when they had given up, they did not know what was going on.
We have a wide variety of drugs today that are available. We have, for example, steroids. We have anti-inflammatory drugs. We have biological drugs that are now available for managing these disorders.
They continued me with the same medication, which was steroids, prednisolone. I improved. I was there for about a year and a half, came back.
And that's when the flares became so big, such that she had to leave school completely, and I had to leave my place of work because we had to attend to her on a daily basis, going to hospitals on a daily basis because she was almost crippled.
During that time, I was immobile. I used to sit a lot. It was either I'm sitting or I'm lying down. So my hip joint, the left one, got really damaged. And the doctor told me now this one, because no medication is working, we'll have to do a total hip replacement. That's where they replaced the whole hip joint.
As a father, had to be there for her, both financially and also as a parent. Her siblings were really affected because I remember at one time she could wake up in the morning, she's not feeling all right, and they could not go out to pray because they can see that their sister is not feeling all right.
One of the symptoms of the disease is sometimes you can wake up with a very serious fatigue, so we help her around with the activities, various activities in the house, and also accompanying her to do some of her errands, and also getting her medication from the various chemists and hospitals, and also especially like the recent one where the hydroxychloroquine, the HCQS medicine, it was missing from the chemists. We used to help her to get source for the medicine from the various chemists, because most of the chemists, when you go to them, they will say that it was out of stock.
There's a doctor I met, a rheumatologist, who had come from the US, and she introduced me to some surgeons who come to Tanzania to do hip replacements, joint replacements. And I talked with them, and they told me they were coming. That was in 2013. So I traveled to Arusha. That was in February. I had the surgery. I stayed there for a month, came back. I was healing quite well until later on in the year I had the joint pains, the hip started paining, and the X-ray showed that the implants, part of the implants were starting to become loose because of the underlying issue of rheumatoid arthritis and lupus. The bone density around the pelvic area was quite damaged, and they needed an implant that needed to be fixed there, and Kenya didn't have it, so I had to travel to India. That was in 2017 December. I got there, and they usually do a full body checkup. Before that, in between, I had because of the immunity being so low, you're prone to infection. So I'd gotten some chest infections. I got there, they told me my lungs were not okay, so they had to derail the surgery. I was put on some medication. I took about 4 months to recover so that they could clear me for surgery. The surgery went very well, came back home 2018 October, and since then I've been healing, doing physiotherapy, able to walk around the house without the aid of a crutch, but when I go outside I walk with a crutch.
She has continued fighting, and just seeing her walk with, at times even walking without the crutches, I mean, it's just amazing. You know, how we're helping Washara is engaging different pharmacies, engaging different doctors, engaging different laboratories to get cheaper services, or rather cheaper rates as far as this condition is concerned, because treating and managing this condition is quite costly.
I was referred to Dr. Simani from a rheumatologist who was seeing me in the UK. When I first saw him, he was working at Kenyatta National Hospital. That's where I was going to see him for about close to 2 years. And he's been seeing me till to date. And I'm grateful to say that I've made very good progress till now.
Oh, that's good.
Yes. Dad,
Yes, how is he?
he's doing well. He studied the NHIF. Yeah, I've always thought it's because of the...
That's what I always do, bringing the lupus warriors, helping them where I can, just to work with them, bringing her to see her doctor, and also taking her back home.
You travel well?
Thank you.
Okay.
Thank you for the masks.
And we are welcome. Make sure you protect yourselves.
Thank you.
A diagnosis can be made,
Saline.
and when a diagnosis is made, it's not the end of the world. There is a life after the diagnosis. It is possible to lead a reasonably normal life, and it is important also for patients to take time, read about the problem, and remember that you are not alone. There are many people who are with you, and it will be well.